Bed Alarms and Falls, Nurse Residency Project, January 2021. Presenters: Bailey Woods, St. Luke's East Hospital, Cardiovascular Recovery Unit. Jenny Taylor, St. Luke's Hospital, Float Pool. Ashley Ishkuntana, St. Luke's East Hospital, Float Pool. Erica Tamburini, St. Luke's East Hospital, Cardiovascular Recovery Unit. Janelle Nagley, St. Luke's East Hospital, Progressive Care Unit. Sarah Turner, St. Luke's East Hospital, Progressive Care Unit. Kelsey Barrett, St. Luke's East Hospital, Progressive Care Unit. Dustin Waters, St. Luke's East Hospital, Cardiovascular Recovery Unit. PICO Question. P. Acute care hospitalized patients. I. Turning on all bed alarms prior to shift change. C. Not turning on all bed alarms prior to shift change. O. Decreased number of falls.
The subject of bed alarms and falls during shift change was chosen because as our group was discussing topics, many of our suggestions returned to patient safety. It was noted that during shift change, when nurses and other staff are doing report, there is often an extended time frame on call-out response time. The group then questioned if there was an increase in falls during these times when the staff is focused on the report, therefore not as quick to respond, and what could be done to correct the issue. As discussion progressed, the question of whether or not confirming all bed alarms were turned on prior to report would help to decrease the number of falls.
This article, titled Who, Where, and Why: Situational and Environmental Factors Contributing to Patient Falls in the Hospital Setting, covers a study performed in Australia at St. George Hospital. This is a 650-bed hospital located in Sydney. The study's purpose was to identify patient characteristics and circumstances surrounding falls of patients in the hospital. The study ran for 10 weeks in 2001, and descriptions were provided surrounding the circumstances of each fall on incident reports. A total of 118 falls were reported during this time. The average age of the patient who experienced a fall was 75.5 years old. The most common time falls occurred was between 0700 and 0800 and between 1400 and 1500. Overall, 48.5% of falls that occurred were between 0700 and 1500, making daytime the more frequent shift for a fall to occur. The study also showed that the most common activity at the time of the fall was when the patient was getting out of bed. 75.4% of the falls happened in the patient's room. The results of this study are suggestive of the following. The peak time indicates a pattern of falls occurring at shift change, and more falls occurred on the weekends when there was decreased staffing. This study recommends ensuring adequate staffing during peak fall times. This would include staggering break times.
In exploring practices of bedside shift report and hourly rounding, is there an impact on patient falls? Researchers sought to demonstrate the relationship of falls to bedside report and hourly rounding. In this study, researchers observed 9,693 patient and RN interactions on 11 separate inpatient units over 1 year. These observations were made at 4 separate urban hospitals. The research demonstrated that for each reduction in number of times the patient had hourly rounding, the odds of falls increased by 1.2 times. In addition, lack of nursing time and interactions with patients have also been associated with higher risks of falls. So while bed alarms and chair alarms and gate belts are great tools to help prevent falls. The greatest prevention that the research demonstrated was nurse and patient interaction and time together. One limit of this study was it didn't look at the quality of the interaction. It was just the number of times there were interactions. There are so many resources allocated to fall prevention, as falls are such a significant healthcare cost. It is estimated that falls account for $50 billion annually in the U.S. alone. And in 2005, Congress identified falls as a hospital-acquired condition that would not be covered by the Centers for Medicare and Medicaid. So health systems are extremely motivated to prevent falls and put policies into place to prevent them. However, more research is needed and there are more studies needed to help understand the most cost-effective use of time and these resources. One of the greatest resources, obviously, are nurses or staff, which is also one of the most costly to provide. But hourly rounding does significantly reduce the risk of falls, which is one tool that we do use at St. Luke's to help keep our patients safe.
Another interesting article we found that further examined fall risk factors and subsequently what could be done to prevent them was Seasonal Ambient Changes Influence Inpatient Falls, written in January of 2017. The authors are listed above. If I tried to pronounce them, I think I would not do them justice, so I will let you just read them for yourself. This is a C level of evidence, as it is a retrospective chart review study. It would again fall into the category of level C, as it is descriptive and correlational. The study aimed to compare behavioral and environmental factors, especially seasonal and or diurnal variations, which means variations of falls during the day. So the researchers examined whether falls were more prevalent at different times of the day, as well as different times of the year, or at different room temperatures. I found it interesting that this article focused not only on the internal risk factors like age and health condition, but also on the external risk factors such as the time of day and temperature of the room. To conduct the study, the researchers looked at 464 falls from a total of 3,037 incident reports from April 2010 to March 2014. These reports came from a secondary emergency facility in a suburb of Fukuoka City, Japan. The article had two main points. The first was that falls were more frequent at nighttime than daytime. That is not a great surprise, as it is darker at nighttime and patients cannot see as well. And some patients are more confused at nighttime and impulsively try to get out of bed during those hours. It is interesting to know that the number of falls increased during the months of November, January, and February, times when the sun goes down earlier. The second point was that falls were more frequent during dawn and the hours leading up to it, specifically between the times of 2 and 7 a.m. The researchers think that the increased number of falls that occurred in the winter months of November, January, and February were due to patients attempting to get up and walk or go to the bathroom while it was still dark and cold. All of this while they were still half awake. So after examining the information above, the researchers made two recommendations. The first was to allow for a more well-lit and warmer environment. Most hospitals have dim lights that could be left on during the night, and this might prevent patients from being confused and impulsively getting up after they wake up in an environment that is different from what they are used to. Also, warming up the room may keep the patients more comfortable in bed and less likely to get up on their own. Their second recommendation was to toilet patients before shift change. Toileting activities were the main cause of falls in this study. If the healthcare team was proactive in toileting their patients at regular intervals, and especially before shift change, they would likely prevent falls that occur from patients impulsively trying to go to the bathroom. And so finally, how does this article relate to our PICO question? Well, this study has shown us that when the sun sets earlier during the daylight savings time months, patients are at a higher risk of falls due to the dark and cold environment. If the nurses were to toilet patients before shift change and then ensure that all the bed alarms were on, since the room will still be dark at shift change, patients will be less likely to impulsively get out of bed and fall.
The fourth article that our group has decided to use to help support our PICO question is this article here. The title of it is Using a Fall Prevention Checklist to Reduce Hospital Falls, Results of a Quality Improvement Project. And the level of evidence of this article is a level C. And then the article's main points were identifying that some components of fall prevention interventions were being missed. Big ones such as bed alarm placements and signs in and outside of patients' rooms. So I know at St. Luke's East we have these yellow signs that we can stick outside of each room. They kind of go over the method of transportation that patients use, as well as if they are or not a fall risk. And the other big component that the article is looking at is by implementing the checklist prior to taking over patient care from that previous nurse or nursing assistant, would this help decrease the number of falls in that hospital? The purpose of the study, the article mentions research had been done and completed by the Joint Commission. And the research showed that falls with serious injury are consistently among the top 10 sentinel events. So this means, these falls in the hospitals are causing serious, if not deadly, injuries. High cases of falls in the hospital setting is caused because staff are not sticking to and incorporating fall prevention protocols every shift. So the main purpose is to improve the consistency of sticking with and implementing the fall prevention methods by all healthcare workers. Typically, when getting a report, I know that a lot of times really that's only mentioned is the way that the patient gets up and if they are or are not a fall risk. So this checklist can help determine whether or not the interventions are being completed and done prior to obtaining full nursing care of each patient. The methods that were used for this study, 26 days is what it took to complete the study. Both day and night shift participated, so 13 days on day shift and then 13 nights on night shift. And the study took place at the university-affiliated National Cancer Institute on the designated cancer center. Both nurses and nursing assistants coming in would implement the checklist. The checklist, I guess I would think, to me, it's kind of similar to what we use during charting. And it goes over, if they're using the yellow wristband, if they have the non-stick socks on, their bed alarm's placed, and if it's in the lowest position. So this list implements all of those plus more. So once all 90 fall prevention checklists were compiled, two big components of this checklist were being missed. The first one being bed alarms were incorrectly set. So if you looked at the chart here to the right, it says that 19 out of the 90 checklists say that the bed alarms were not set on Zone 2. In the article, it says that Zone 2 is the standard for the hospital's bed alarm settings for all patients who are at a risk for falls. So I know for St. Luke's, it would be similar to our middle setting there on the beds. With Zone 2, it would alarm for small movements such as leg movements. This would cause for false alarms to sound. This might cause staff to not want to place the alarms to prevent inappropriate alarms to sound. And then the second big component that was missing were the signs on the hall or on the doors of each patient's room and as well inside of the room. The article mentions that staff would simply just forget to place the signs once the patient was admitted, just because there's so many other things going on and, running through their minds at the time. So they would forget to place these signs. And then from February 12th of 2018 to March 9th of 2018, so a little less than a month that this had taken place, this study took place, there were no falls, and compared to the prior 3 months, there were less falls as a result of this checklist. And so the conclusion, by assessing patients' risk for falls, making sure all interventions are being implemented prior to taking over care of a patient can ensure all actions are being taken to prevent patient falls, especially those who are at a higher risk for falls. And in this study, it does help support our PICO, making sure that the bed alarms are placed for those who are at risk for fall prior to shift change.
This slide is a list of recommendations to decrease the number of falls in the acute care hospital setting by turning on all the bed alarms prior to shift change. First, we would want to implement the fall safety checklist prior to taking over patient care, as you can see in slide 11 and 12, according to using a fall prevention checklist to reduce hospital falls. Sometimes it's just the simple things that are missed, like not putting the bed in the low position or making sure that a patient has fall prevention socks on that are missed. Also, according to Exploring Practices of Bedside Shift Report and Hourly Rounding, it's really important that nurses are doing bedside report and safety checks to ensure that all of those safety precautions are in place to decrease the number of falls. Also, hourly rounding is a huge way to prevent falls as well. Another recommendation comes from Seasonal Ambient Changes Influence Inpatient Falls. This article talks about when the sun sets earlier after fall daylight savings time, and when it's still early in the morning, it could be beneficial to turn on all bed alarms since the room is still dark, putting patients at risk for falls.
Well, that about wraps it up. Are there any questions? I'm sorry, this recording has limited responses. You must ask the right question. No, I'm just kidding. If you do have any questions, please feel free to get a hold of any one of the group members, and we will do what we can to get you your answers. And if you feel like digging into the subjects a little bit more, you will find our references attached on the next slide. Thank you.